Welcome to Muscle Research Review for the week of March the 30th, 2015. Quick research summaries for the very busy health and fitness professional. So let's get started. The first study looked at the comparison of the isolated contraction ratios of the hip extensors and the erector spinae muscles of the lumbar and thoracic muscles during different back extension exercises. The contraction ratio indicates the proportional contribution of a muscle to a motion. The study involved 12 male subjects who performed 3 exercises: the bridging exercise, the Sorensen test, and a Roman chair exercise. Here's what they found. Bridging exercise significantly increased gluteus maximus contraction ratio. The Sorensen test increased the thoracic ratio, and all 3 exercises were equally effective in the lumbar contraction ratio. The study shows that selective activation of the different back extension muscles is possible, and you may need to integrate different exercises into a program to get the full benefit. Do groin injury prevention programs actually work? That's the question posed in a systematic review with meta-analysis of randomized controlled trials. The review included 7 trials, 6 on football players and 1 on handball players. There were 4,191 participants with a total of 157 injuries. The results were surprising in that the analysis did not show a significant reduction in the number of groin injuries after completing a groin injury prevention program. However, meta-analysis revealed a potentially clinically meaningful groin injury reduction of 19%. What's your take on this? Do you use a groin injury prevention program? If so, have you seen reduction in injuries? Does adding ankle and midfoot mobilization to your treatment program provide any effects on plantar fascitis treatment outcome? Well, a new randomized controlled trial set out to answer this question. The study divided 50 patients into an intervention and control group. Both groups received 8 treatments twice a week, consisting of stretching and ultrasound. The intervention group received additional mobilization of the ankle and midfoot joints. The study looked at the numeric pain rate scale, the lower extremity functional scale, and algometry. Both groups improved significantly in ankle dorsiflexion range of motion, with no differences between the 2 groups. Now, the results showed that adding mobilization had no additional benefit. Now, the study concludes that the limited ankle dorsiflexion in those with plantar fascitis is most probably due to soft tissue limitations and not to the joints. Now, I usually add mobilization to most of my plantar fascia patients. If you do, does this study change your treatment strategy, or are you seeing much different results in your practice? If you treat hamstring injuries, this study is for you. The study asked the question, is connective scar tissue, also known as fibrosis, a predisposing factor for re-injury? Now, the study looked at MRI findings of 108 consecutive athletes with grade 1 or 2 hamstring injuries. At initial injury, 43% had grade 1 and 57% had grade 2 injuries. Now, the median return time to play was 30 days. At return to play, 38% had fibrosis on MRI. Now, re-injuries were recorded over a 1-year follow-up. For those with fibrosis, 24% had a re-injury. Surprisingly, 24% of those without fibrosis also had a re-injury. Now, the study showed that fibrosis seen on MRI is not associated with a greater risk of re-injury. The study comes in a long list of results that tend to question whether MRI results should actually dictate diagnosis or treatment outcomes for various conditions and injuries. What's your take on the study? If you have any comments, please leave them below. Also, make sure to subscribe to our YouTube channel to get the latest quick research summaries to keep you up to date. See you guys next time.